Welcome to the Deep Dive, where we take your curiosity and turn it into true understanding. So today we're jumping into a topic that, is way more impactful than I think most of us realize, dental anxiety. It's this huge silent barrier that keeps so many people from getting care they really need.
It really is. And for this, we have a fantastic set of sources all focused on one specific practice, My Gentle Dentist in Arana Hills. And they've built their whole model around this idea of gentle care.
Right. So our mission today is to pull out the blueprint, the actual practical strategies they use. We want to see step by step how they create a stress-free environment.
Exactly. Because the stakes are really high, the sources are so clear that dental anxiety isn't just, feeling a bit nervous. It's super common. It affects everyone from little kids to adults who've had genuinely bad experiences in the past.
And that anxiety, it's not just a feeling. It has real consequences.
Oh, absolutely. It's clinically dangerous. It makes people delay treatment, sometimes for years, and that just leads to bigger, more painful, and frankly, more expensive problems down the line.
The definition of a vicious cycle.
It is. And this practice, which is led by Dr. Deepak and Dr. Deepti Parwani, they specifically aim to, and I'm quoting here, break that cycle. They want to confront that fear head on.
Okay, so let's unpack that. This core philosophy. What's the guiding principle that really shapes everything they do?
Well, the absolute heart of it is gentle care. And that's all built on the vision to put every patient's interest first. But what's really interesting here is the ownership. It's a family-owned and operated practice. And that's not just a nice little detail. It seems to change the entire approach. They use the phrase like family a lot.
Which means you're not just thinking about getting a procedure done quickly.
Right. You have a long-term stake in that person's comfort, their whole experience with you.
Yeah.
It's about the relationship.
That makes a lot of sense. So the success isn't just a healthy tooth, it's a healthy relationship with going to the dentist. The expectation, then, is that from the moment you walk into their clinic at Arana Hills, the entire environment has to signal safety and calm.
Exactly. The psychological management starts way before you even get in the chair.
Okay, so let's get into the tangible stuff. Pillar 1, communication and control. Because good intentions are one thing, but you need specific techniques for this to work.
The first thing is the staff. They are explicitly trained to listen. And I mean, really listen. They'll ask about your history, your bad experiences, what specifically you're afraid of. Is it the needle, the sound of the drill? What is it?
So it's not just procedural small talk before they start working.
Not at all. It's about shifting the power dynamic right from the start. And then there's patient education.
Which, again, can sometimes just be a formality. How do they make sure it actually lands and empowers the patient?
This is where it gets strategic. They use visual aids. The sources talk about intraoral cameras, for example. The dentist can literally show you the issue on a screen. So the fear goes from this abstract thing inside your head to a concrete, manageable problem you can see.
You become a partner in the diagnosis.
Yep, that is a huge anxiety reducer. But this next part is maybe the most important thing.
This is the part that really stood out to me, the stop signal.
Yes, this is non-negotiable. They set up a hand signal with the patient. And if you raise your hand for any reason, the treatment stops. Immediately, no questions asked.
That is such a simple, but what a profound shift in power. For anyone who's ever felt vulnerable in that chair, that guaranteed control must be everything.
It is. Because anxiety often comes from that feeling of helplessness, of losing control. By making the stop signal an unbreakable rule, they build this incredible foundation of trust. It lets the patient relax enough for the work to even happen.
Okay, so moving from the psychological side to pillar 2, the actual tools for comfort and pain management. Because all the communication in the world won't help if the procedure itself is painful.
Right. And they don't just say state-of-the-art technology. The sources are specific. The big one is happy gas or nitrous oxide. They offer it for nervous patients. And it's described as a really safe, effective way to just feel calm and relaxed. You're not asleep, just detached.
Yeah. And here's the crucial detail for a lot of people. It wears off quickly. So in most cases, you can drive yourself home. It removes that whole logistical stress of needing someone to pick you up.
Exactly. And beyond the gas, there's technology that targets specific fears, like the injection, the needle.
The part everyone dreads.
Well, the sources suggest they use something like the wand, which is a computer-controlled anesthesia delivery system. It delivers the anesthetic so slowly and precisely that the injection can be virtually painless. It just removes one of the biggest anxiety hurdles.
That's a complete game changer. What about other things, like the sound of the drill or just how long things take?
That's where precision comes in. Modern tech means treatments are faster, they're more precise, which means less time in the chair. And they're often minimally invasive, so you have less discomfort afterwards and a quicker recovery. The technology is there to support the gentle philosophy.
So let's talk about Pillar 3, applying this across all their services. Does this gentle approach hold up when you're talking about something complex like a root canal versus just a simple checkup?
It seems to. The philosophy is everywhere. For routine checkups, they intentionally take it slow. You never feel like you're on a conveyor belt. And when it comes to kids' dental, they are laser-focused.
Making sure that first experience is a good one.
It's preventative psychology. They're trying to stop the fear from ever developing in the first place.
And the sources confirm this isn't just for the easy stuff. Even for root canals or extractions, the focus is still on pain management and comfort.
And the proof is in the testimonials. They aren't just generic five-star reviews. People specifically say things like, "The team listened to my concerns," or "It was a calm and caring experience." Even for wisdom tooth extractions, which is, a famously stressful procedure.
Right. So the pillars are clearly working together.
They are. The communication and the tools directly lead to better patient experiences, even for the tough stuff.
So if we connect all this to the bigger picture, we know dental stress isn't just what happens in the chair. It's logistical, it's financial.
Right.
What did the sources say about how they handle those external stressors?
That's a crucial part of the whole model. They know that if it's hard to get to the clinic or stressful to pay for the work, that anxiety just gets layered on top of the clinical fear. So they do simple things, like making sure the location is easy to get to, with plenty of parking, little things that matter when you're already on edge.
And then there's the big one, the financial barrier.
Exactly. The practice offers interest-free payment plans.
Yeah.
And that's a very deliberate strategy. It means that if you need complex work done, you don't have this massive financial pressure hanging over you. It stops people from putting off necessary treatment because of cost anxiety. A gentle environment has to include financial peace of mind.
This has been a really fascinating look at how a philosophy can be turned into a concrete system. For you, the listener, I think the core takeaway is pretty clear. Overcoming anxiety like this relies on a very specific combination of things.
It really does. It's that active listening, first and foremost. Then guaranteeing absolute patient control. That stop signal is the perfect example. And then backing it all up with modern tools that actually reduce pain and discomfort.
Yeah.
They've built a blueprint where trust is something you earn, not something you just expect.
It really sets a high bar.
It does. And it leaves us with a really important question to think about. If communication and guaranteeing the patient is in control are this powerful in dentistry, where else in medicine, or even outside of medicine, could implementing a mandatory stop signal just completely transform the user experience and build that kind of deep trust? Think about that level of guaranteed agency the next time you feel overwhelmed in any situation that demands your trust.